Okay, so I wanted to do a video about the Affordable Health Care Act, or ObamaCare. Just dispel some things. And yeah, I'm going to be unoriginal. I'm going to be reading from addicting info. Basically, almost word for word, explaining what ObamaCare is all about. So, allow me to turn my face away from the camera as I read. And this is going to be a long video, so listen closely. Listen. Sure, you've heard that there's a lot of hype going around about Obamacare. You could be getting mixed information. So, here's what is and what isn't. Obamacare will not use your tax dollars to fund abortions, despite what you might think. Is not and will not lead to government takeover of health care. Will not increase the national debt or deficit. Does not hurt health insurance companies, but actually increases their business. Are you getting it now? It's not unconstitutional. And it is not socialism. You Tea Partiers don't even know what socialism is. You think that just because your older brothers and sisters or uncles fought the commies in the Cold War, you got to buy into their bullshit. You don't, because you don't know what socialism is. All right, back on topic. Obamacare is not government-run health care. That's a very dangerous misconception because, you know, the politicians are just misleading the American public about it. If anything, government-run health care would involve a health insurance program that is entirely implemented and managed by the government, i.e. Medicare and Medicaid. Obamacare is actually designed to promote a competitive free market for private insurers to offer their services to the American people, so no one could actually argue that this is a highly capitalist endeavor. Capitalism. The same model we've been running on for years. Besides, if Obamacare was government run, we would only be allowed to sign up for Medicaid and nothing else. So, I mean, you got to think about that. It's very cut and dry that everything you've learned from your politicians is wrong. Dead wrong. It is a federal law requiring all Americans to have health coverage by next year, 2014. I mean, it's, you know, you're required to have car insurance when you get a car, so, you know, you gotta have this, you gotta have health care. You just have to. You might be wondering how Obamacare will affect your insurance costs and coverages. Before Obamacare, your premiums were determined by age, health, and where you live. And insurance companies could deny anyone coverage due to health status, genetic information, pre-existing conditions, domestic violence, and so on and so forth. And especially if they believed you would cost them too much money. As of September 23rd, 2010, insurance companies are no longer allowed to deny coverage to children under the age of 19 who have a pre-existing condition. And they can also no longer place a cap on a child's lifetime coverage. Because, I mean, before Obamacare, children used up their lifetime coverage before the age of 10, a lot of them. Yeah, well, a lot of kids died because of that. But it doesn't have to be that way anymore. That's what I'm saying. You know, it just... Beginning January 1st of 2014, these protections will be enacted for children under the age of 19. Under Obamacare, the premiums will be determined solely by family structure, geographical location, tobacco use, participation in a health promotion program, age by not more than 3 to 1, and actuarial value. Actuarial value is the percentage of medical expenses covered by the insurance plan. For example, if the actuarial value is 80%, your insurance plan would pay for 80% of your medical costs while you'd be responsible for 20%. The higher your actuarial value, the higher your premium. However, you will no longer be charged a higher premium due to your current state of health or pre-existing condition. I mean, your insurance company still can deny you coverage of a particular treatment, but only if that specific treatment is not offered to anyone who's enrolled in the plan. For example, if your policy does not cover a specific prescription drug, you will be required to pay out of pocket or seek a different prescription from your doctor. But the stipulation cannot single out individual members and must apply to everyone or no one. You might ask, what if I already have health insurance? Well, nothing will really change for you. You will not be forced to switch or to buy new health insurance. I mean, that would be kind of stupid, wouldn't you think? Oh, under Obamacare, you can't have this coverage anymore. You must buy this one. Really? The Republicans want to threaten the American people with that, which is just downright ridiculous. So, I mean, don't listen to them. Affordable Care Act will ensure that quality health care is available and affordable to everyone. I mean, the Affordable Care Act, if you like your doctor and your plan, you can keep them. Can I still choose my own doctor? Yes. In fact, the new protections under Obamacare will make it so that you will have access to more doctors and better doctors. That's right. Maybe this is something I should look into if I want to change doctors. But I'll cross that bridge when I come to it. If you are enrolled in a health plan that requires you to designate a specific primary care provider, the new law guarantees your right to choose that doctor yourself. The only stipulation is that the doctor must be enrolled in your plan's provider network and must be accepting new patients at the time. Not all health plans require you to designate a doctor. In those cases, you will be able to visit any doctor you want. Will I still get quality care from medical professionals? Of course you will. The new law will give doctors more power to make decisions about your treatment than ever before. In the past, doctors were hesitant to utilize certain treatments for fear that insurance companies would target individuals with certain medical conditions and raise their premiums. Under the new law, health insurance companies can no longer discriminate against individuals due to health status or pre-existing conditions, giving doctors freedom to utilize whatever treatments they see fit. Hospitals accrue up to $49 billion in unpaid hospital bills from uninsured patients each year. But I mean, even if the patient is uninsured, they still got to treat you. It's just, it's going to cost you and it's going to cost the insurance companies. So that's why you need that insurance. Because I mean, I know a few people who either don't have insurance or all they have inadequate insurance, and they have to have like a life-saving procedure. Now, luckily, these people are still alive that I know, but they've gone through hell financially because of poor insurance or lack thereof altogether. So, while some of these costs will never be compensated, I was going to say constipated, the federal, state, and local governments currently cover the remainder of these unpaid bills in the form of disproportionate share hospital payments, or DSH payments. More specifically, the government pays hospitals around $40 billion per year to cover the care provided to uninsured patients who couldn't or didn't pay their bill. Because Americans will be required to have health coverage under ObamaCare, hospitals will be compensated for their care and will no longer need to increase the cost of their services to offset lost income. This will also save the state and federal governments billions of dollars in DSH payments each year. How do I get coverage, and what if I can't afford it? Well, first of all, companies with more than 200 employees will be required to automatically enroll in new full-time workers in a health plan. However, employees are free to opt out and purchase their own private insurance if they so choose. Companies with 50 or more full-time employees will be required to provide them with health coverage or pay a tax penalty for each employee. Once again, employees are free to opt out, but they gotta offer you something. Otherwise, they'll face a penalty of at least $2,000 per employee. Small businesses with fewer than 25 employees who choose to provide coverage for their workers will be eligible for a tax credit of up to 50% of the employer's contribution towards employee health premiums after 2014. The credit is 35% up until 2014 and will increase further thereafter. This is because they are not required to provide health coverage under Obamacare since they have fewer than 50 employees. In other words, the government will reward them for stepping up and providing coverage anyway. There's a chart. I'll put a link to the article in the description so you can look at the chart, because I don't have time to explain that. And it says that healthcare exchanges will be set up at either state or federal level depending on the decisions of each individual state. What this means is that people will be able to go online to these exchanges and shop for a health plan that meets their personal and financial needs. Think of it like Amazon.com for health insurance. Some states have decided to run their own exchanges, while others have passed on the responsibility to the federal government. Kind of stupid, don't you think? Other states have decided to set up a hybrid exchanges run by both the state and federal governments. This means that people with income between 100 and 133% of the federal poverty level will either be exempt from the mandate or will be automatically enrolled in their state's Medicaid program. States are allowed to opt out of Medicaid expansion, and some have already elected to do so. Sucks to be them, I guess. It means that people with incomes 133% of the federal poverty level or lower will be exempt from the Obamacare mandate. But that's only if their state has opted out. Yeah. I mean, you're still free to purchase private health insurance. Individuals and families with incomes between 133 and 400% of the federal poverty level will be eligible for premium and cost-sharing credits that will help pay for the health plans in order to avoid imposing an unfair financial burden on the person or family. The credits will be applied to your federal tax income return each year. Like say, you got a family of 4. At 100%, that's $23,050. 133%, that's $30,657. At 400%, that is $92,200. And up the medical expansion, Florida, where I live, is still undecided about it, but most of the southern states, no surprise, are not going to participate in it, whilst most of the states out west and in the northeast are all for it, except for Maine, because what the fuck, Maine? Really? Get with the program. You're not part of the South. You can be included in this. Now, what if I choose not to get coverage? Hey, that's your call. If it's greater than 133% of the federal poverty level and you do not have health coverage through work or Medicaid or private insurance, by 2014 you will be charged a penalty tax each year that you are not insured. This will be phased from 2014 to 2016. You will either pay a flat fee or a percentage of your taxable income, whichever is larger. For children under the age of 18, the penalty will be 1/2 the amount for adults. Now, the last little bit is, won't this cost the government a lot of money? Well, yes, it will. I mean, there's no sugarcoating that, but it will. It will cost, Obamacare will cost the government a lot of money, but it will end up saving the government far more money than it will actually spend by implementing the mandate. Of course, Republicans are going to argue against this because what do they know? They're fear-mongers. Obamacare will save $200 billion in Medicare expenses by 2016 and $208 billion for Medicare patients by 2020. Obamacare is designed so that the money the federal government invests in the mandate is offset by savings in other areas. For example, as mentioned above, Obamacare will save the federal government billions of dollars in DHS payments to hospitals each year, since they will no longer have to foot the bill for uninsured patients who can't pay. So, I mean, yeah. That's the skinny on the Affordable Care Act, or Obamacare. Do what you want with this information. Just, try to understand it as best you can and don't twist it. I'm signing out.